What I'm about to show you may completely change the way you think about your blood pressure medicine. Because if you are taking amlodipine, losartan, or lisinopril, there is a very real chance that at least one symptom you've been blaming on age, stress, poor sleep, or just a rough week is actually coming from the pill you swallowed this morning. And what makes that so dangerous is not just the side effect itself, it's the delay. It's the weeks or months people spend explaining it away while their body keeps sending louder and louder warning signs. Right now, somewhere, a senior is getting up from a chair, feeling suddenly unsteady, grabbing the wall and telling themselves, "I'm just tired today." Somewhere else, another person is looking at swollen ankles, assuming it's salt or the weather, when in reality the medication meant to protect their heart is quietly changing the way fluid moves through their body. And someone else is lying awake at night with a cough that won't stop, not realizing the problem may not be their lungs at all. That's how these medicines fool people, not because they're bad medicines, because their side effects often disguise themselves as ordinary life. I'm Dr. David M. Reed, and after more than 2 decades of treating heart patients, I can tell you this with complete honesty. Some of the most important conversations I have with seniors are not about whether a blood pressure medication works. It's about whether the person taking it recognizes what their own body is trying to tell them. Because these medications can absolutely save lives. They lower stroke risk. They reduce strain on the heart. They protect blood vessels over time. But if you don't know the side effects, you can end up frightened by symptoms you don't understand, or worse, ignoring symptoms that should have prompted a phone call days earlier. And today, I'm going to walk you through the 7 side effects every person taking amlodipine, losartan, or lisinopril needs to know. Not in a dry textbook way. I'm going to show you how these side effects actually appear in real life, how they trick people, which medicine is more likely to cause which problem, and when a symptom is merely bothersome versus when it becomes urgent. Before we begin, please subscribe to this channel because videos help seniors protect their hearts, avoid mistakes, and stay safe. But before I show you side effect number 7, I need to tell you about Janet, because her story reveals the biggest misunderstanding people have about blood pressure medicine. Janet was 72, disciplined, responsible, the kind of patient every doctor loves because she followed directions exactly. She took her medicine on time every day. She tracked her pressure. She walked after dinner. She did everything right. Then, slowly, she started feeling off. Not sick enough to call it illness. Just not herself. A little washed out. A little heavier in the legs. A little more tired than usual. And because the change happened gradually, she never once thought, could this be the medication? She thought, I guess this is what getting older feels like. That is exactly why this topic matters so much. Most medication side effects do not announce themselves dramatically at the beginning. They creep in. They borrow the mask of aging. They borrow the language of everyday discomfort. And the result is that people live with symptoms they should have recognized much sooner. So let's start with side effect number 7, because it seems mild, it sounds harmless, and yet it is one of the first clues that your body is reacting to a blood pressure medication. Side effect number 7 is headache, facial warmth, flushing, or that strange pounding sensation that can happen especially after starting amlodipine or after the dose is increased. Let me tell you about Barbara, age 69. Barbara started amlodipine after several weeks of high readings. 3 days later, she called her daughter and said, "Something is wrong with me. My face feels hot, my head feels full, and my heart feels more noticeable." She was convinced her blood pressure was dangerously high, but when she checked it, it had actually come down. The medicine was doing its job. The side effect was what frightened her. Here's why that happens. Amlodipine is a calcium channel blocker. In simple terms, it relaxes and widens blood vessels. That is how it helps lower pressure. But when those blood vessels open up, especially early in treatment, some people feel the change. They may notice warmth in the face, a flushing feeling in the neck, a mild to moderate headache, or a stronger awareness of their heartbeat. It can feel dramatic even when it isn't dangerous, and that's where people get confused. The sensation feels like something is going wrong, when often the body is simply adjusting to a new circulation pattern. Now, that does not mean you ignore it. If the headache is severe, if the heartbeat feels irregular, if chest discomfort appears, or if the symptom is worsening instead of settling, that deserves medical attention. But for many people, especially during the first days or after a dose increase, this side effect eases as the body adapts. Barbara's flushing faded after about a week. Her headaches became milder, then disappeared. But the real lesson from her story is this: the first side effects of a blood pressure medication can feel like the disease is getting worse, when in fact, the body is reacting to treatment. And this brings us to a more deceptive problem, because while side effect number 7 often feels obvious, side effect number 6 is the one people are most likely to dismiss. They do not get scared by it. They normalize it. They make excuses for it. And by the time they realize what's happening, weeks may have passed. Side effect number 6 is unusual fatigue, sleepiness, or a drained, heavy feeling that makes you feel older than you felt a month ago. Let me tell you about Walter, who was 76 and had always been energetic. He wasn't running marathons, but he mowed his own lawn, drove himself everywhere, and played with his grandchildren without thinking twice. Then he started Losartan. Within 2 weeks, he began saying things like, "I just don't have the same engine anymore." He thought maybe he was sleeping badly, maybe the weather was wearing him out, maybe it was just age catching up with him. He never suspected the medication. Fatigue is one of those side effects people almost never report quickly because it sounds too vague. It doesn't feel urgent. It doesn't feel specific. But it matters. With blood pressure medicines, fatigue can happen for a few different reasons. Sometimes your blood pressure has come down and your body needs time to adapt to the new level. Sometimes the medication is lowering pressure a bit too much for your current state, especially if you are dehydrated, sick, eating less, or taking other medicines that also affect circulation. And sometimes fatigue is just the way your body personally responds to that specific drug. Amlodipine can do this. Losartan can do this. Lisinopril can do this. The symptom may show up as afternoon exhaustion, weakness climbing stairs, or that strange feeling of being not exactly dizzy, not exactly sleepy, just not right. That phrase, by the way, is one I hear all the time. Patients say, "I can't explain it, doctor. I just feel washed out." And those words matter, because the body often whispers before it shouts. Walter's doctor eventually adjusted his timing and reviewed his other medications. His fatigue improved. Not because the medicine was evil, because the dose, the timing, and the person taking it all matter. What I need you to understand is that fatigue becomes dangerous when it leads to inactivity, poor balance, or missed meals and missed fluids. A tired senior is more likely to skip walking, more likely to nap at odd times, more likely to stand up too quickly, and more likely to fall into the next side effect without realizing it. And side effect number 5 is one of the most important on this list because it sends more seniors toward injury than people realize. Side effect number 5 is dizziness, lightheadedness, and that sudden unsteady feeling when you stand up. This can happen with amlodipine, losartan, or lisinopril, and it is especially common when treatment first begins, when the dose changes, when you are taking a water pill, or when you are dehydrated. Let me tell you about Rose, 73, who started lisinopril after a routine checkup showed persistent hypertension. On day 4, she got out of bed, took 3 steps, and the room tilted. She had to grab the dresser to keep from going down. She didn't faint, but she came very close. This happens because blood pressure is not just a number on a monitor. It is the force that helps deliver blood to your brain when you change positions. When you stand up, your body has to respond quickly. Blood wants to drop downward because of gravity. Your nervous system and blood vessels have to compensate in seconds. If a medication lowers your pressure more than expected, or if you are dry from sweating, vomiting, diarrhea, heat, or not drinking enough, the brain may not get what it needs fast enough in that moment. The result is dizziness, tunnel vision, weakness, or near fainting. And here is the part people underestimate. A side effect does not need to be dramatic to be dangerous. Rose never hit the floor. She never lost consciousness. So she told herself it wasn't serious. But a near fall is a warning. One bathroom trip in the dark, one staircase, one slippery kitchen tile, that is all it takes. If you're taking one of these medications and you feel dizzy when standing, do not brush it off. Stand up slowly, sit back down if needed, hydrate if appropriate, and report it, especially if it's recurring or getting worse. There is another reason this side effect matters so much. Dizziness creates anxiety. Anxiety makes people skip doses. Then the blood pressure rebounds. Then they restart the medicine and the dizziness returns. That cycle is incredibly common, which is why the right response is not to suddenly stop your medication on your own. It is to figure out why the symptom is happening. Sometimes it's the dose, sometimes it's timing, sometimes it's another drug interaction, sometimes it's dehydration. But if you don't identify the cause, you end up playing tug of war with your own circulation. Now, as dangerous as dizziness can be, side effect number 4 is the one that causes enormous confusion because people think it means heart failure, kidney failure, too much salt, too little exercise, or just bad legs. Sometimes it's one of those things, but very often, especially with amlodipine, it is the medicine itself. Side effect number 4 is swelling in the ankles, feet, or lower legs. Let me tell you about Eleanor, age 71. Eleanor had been on amlodipine for about 6 weeks when her shoes started feeling tight by late afternoon. Then came the sock marks. Then her ankles started looking puffy in the evening. She cut back on salty food. She elevated her legs. She blamed the summer heat. Nothing changed. By the time she called her doctor, she was frightened that her heart was failing. And that fear is completely understandable because swollen legs are one of those symptoms that instantly make people think something serious is happening. Here's what makes amlodipine swelling so tricky. The medicine relaxes arteries very effectively, sometimes more than veins. That means blood can flow into the legs more easily, but the return flow is not balanced the same way. Fluid shifts out into the tissues, so the swelling may not mean the body is retaining fluid in the same way people imagine. It can simply mean the pressure dynamics in the blood vessels have changed because of the medication. That is why someone can develop ankle swelling from amlodipine, even when the medicine is otherwise doing exactly what it was prescribed to do. But please hear me clearly on this. Swelling should never be ignored just because it can be medication related. If you have new swelling, you still need it evaluated. Because sometimes swollen legs are medication side effects, and sometimes they are signs of a heart problem, vein problem, liver issue, kidney issue, or another condition entirely. The clue with amlodipine is often the timing. It appears after starting the drug or increasing the dose. It tends to collect in the ankles or feet. It may worsen by evening and improve overnight. And sometimes the rest of the person feels fine except for those legs. Eleanor's doctor reviewed her medication, checked for other causes, and confirmed the pattern fit amlodipine-related edema. Her plan was adjusted, and the swelling improved. But here's the deeper lesson. When a senior sees ankle swelling, they often focus only on the ankles. What they should really ask is, what changed in the last month? New medicine, higher dose, new combination, new heat exposure, new dehydration. Side effect number 4 is not just about swollen feet. It is about understanding that the circulation in your legs is often the first place a medication announces itself. And now we come to a side effect that does not show up in the ankles or on the blood pressure monitor. It shows up in the throat, in the chest, in the middle of the night, and in long conversations where someone says, "I've had this cough forever, and nobody can figure it out." If you are taking Lisinopril, side effect number 3 may be the one that changes everything for you. Side effect number 3 is the dry, persistent cough that doesn't seem to belong to a cold, doesn't bring up mucus, and just refuses to leave. Let me tell you about Henry, 68. Henry had been started on Lisinopril in the spring. By early summer, he had developed a tickle in the throat. Then came the cough. Not a deep chest cough, not a feverish cough, just an irritating, dry, repetitive cough that kept showing up when he talked, when he laughed, and especially when he lay down at night. He tried lozenges, he tried tea, he tried allergy medicine, and because he didn't feel truly sick, he kept waiting for it to pass. This cough matters because it is incredibly easy to misread. People blame dust, they blame pollen, they blame air conditioning, they blame reflux, they blame old age, and sometimes those things are the cause. But lisinopril, which belongs to a class called ACE inhibitors, is famous for causing a dry cough in some people. The mechanism is a bit technical, but the simple version is this. The same pathway the medicine affects to relax blood vessels can also lead to buildup of substances that irritate the airways in certain people. So the lungs are not necessarily infected. The throat is not necessarily inflamed from a virus. The cough is a medication signal. What makes this side effect so exhausting is not just the sound, it's the sleep disruption, it's the embarrassment in public, it's the frustration of feeling like you always need to clear your throat. It's the way a persistent cough can wear down your patience, your voice, and your quality of life. Henry finally brought it up at a follow-up appointment. His doctor recognized the pattern immediately. The medication plan was changed, and over time the cough eased. Not overnight, but it improved. And that's the important point. If you are taking lisinopril and you've developed a dry cough that won't go away, that connection should absolutely be considered. Now, I want to pause here because some people hear that and make a dangerous leap. They think, fine, I'll stop taking it tonight. No, that is not the message. The message is recognize the side effect and contact the clinician managing your blood pressure. Do not let a nagging cough turn into months of misery, but do not stop a prescribed blood pressure medication abruptly without guidance. These medicines influence your cardiovascular system for a reason. The goal is not panic, the goal is precision. And that brings us to side effect number 2, which is one of the most serious because it can be developing quietly even while you feel almost normal. It can also explain weakness, strange heart sensations, and alarming lab results. This is where Losartan and Lisinopril demand real respect, especially in older adults with dehydration, kidney disease, diabetes, or other medications in the mix. Side effect number 2 is kidney strain and high potassium. I'm putting them together because in real life they often travel in the same conversation. Let me tell you about Martin, 79. Martin was taking Losartan and doing well for months. Then he got a stomach bug, 2 days of poor appetite, loose stools, and barely any fluids. He kept taking his medicine exactly as prescribed because he was trying to be disciplined. By the time he got to clinic, he was weak, shaky, and saying his legs felt strangely heavy. He also noticed he wasn't urinating the way he normally did. None of that sounded dramatic to him. But his labs told a very different story. Losartan and lisinopril work on hormone systems that affect blood pressure, blood vessel tone, and kidney function. That is part of why they are so useful, but it is also why doctors monitor blood work while you are on them. In some people, especially if they become dehydrated or already have kidney vulnerability, these medicines can contribute to kidney problems or allow potassium to rise too high. High potassium is not something you can reliably feel early. That's what makes it dangerous. It may begin silently. Then it starts showing up as muscle weakness, unusual fatigue, nausea, tingling, heaviness in the legs, or palpitations. And here is where many seniors get caught. They assume anything sold as a salt substitute must be healthy. They assume potassium supplements are harmless. They assume over-the-counter pain relievers don't matter. But with Losartan or lisinopril, those details can matter a lot. Salt substitutes often contain potassium. Some supplements contain potassium. Certain other medicines can change how the kidneys handle potassium. Dehydration makes everything less forgiving. Suddenly, a person who was stable for months can have a lab problem that becomes medically urgent. Martin needed evaluation, fluids, and a medication review. The good news is that once the cause was recognized, the problem was manageable. But had he waited longer, the situation could have become far more dangerous. So if you are on Losartan or Lisinopril and you develop marked weakness, less urine, faintness, nausea, or a sense that your heartbeat feels wrong, do not sit on that information. And even if you feel fine, don't skip the blood tests your doctor orders. Those lab checks are not bureaucratic nonsense. They are how we catch side effect number 2 before it catches you. Side effect number 1 is swelling of the lips, tongue, face, mouth, or throat, especially if it comes with hoarseness, trouble swallowing, or trouble breathing. This is the emergency side effect you must know if you take lisinopril, and it can also happen as an allergic reaction with other medications. Let me tell you about Gloria, age 74. Gloria had been on lisinopril for months with no major issues. Then one morning she woke up and felt like her lower lip was strange. Not painful, just strange. By breakfast, her lip looked fuller. By lunch, her tongue felt thick. She told herself maybe it was something she ate, maybe a bite, maybe an allergy. By the time her daughter saw her face, the swelling was obvious. This condition is called angioedema, and with lisinopril it is rare, but it is serious. The terrifying part is that it does not always start dramatically. It may begin with mild swelling, a funny feeling in the mouth, hoarseness, or trouble fitting words around the tongue. People try to reason with it. They try to wait it out. They want to avoid making a fuss. But swelling in the face, lips, tongue, or throat is not a symptom you watch casually at home. Because if that swelling moves inward and compromises the airway, time matters. A lot. And here is the cruel trick of side effect number 1. Because it can appear after someone has already been taking the medicine, they assume it can't possibly be the drug. They think, if I were allergic, it would have happened right away. Not necessarily. That assumption has delayed care for too many people. Gloria needed urgent treatment. She did well, but only because her family acted when they did. So let me be as plain as I can be. If you are taking lisinopril and you develop swelling of the lips, face, tongue, or throat, or difficulty breathing or swallowing, that is urgent. That is not something to discuss with a neighbor and revisit tomorrow. That is immediate medical attention. And notice what we've just uncovered. The most dangerous side effect on this list is not the one that happens most often. It is the one people are most likely to rationalize for just a little too long. That's why I saved it for last, because by now you can see the pattern in all 7 of these side effects. The real danger is not only the medicine, it is the story people tell themselves about the symptom. Now that you know the 7 side effects, I want to tie them together because this is where the confusion clears up. These medicines are different, but the body's warnings often overlap. Amlodipine is especially known for swelling, flushing, headache, and sometimes palpitations or fatigue. Losartan can bring dizziness, tiredness, and it deserves respect when it comes to dehydration, kidney stress, and potassium. Lisinopril is the one that should make you think of dizziness, persistent dry cough, kidney monitoring, potassium issues, and that rare but critical swelling reaction. And any of them can interact with illness, heat, poor fluid intake, dose changes, or other medications in ways that intensify side effects. Let me tell you about David, because his story is what happens when all of this gets misread at the same time. David was 77 and taking medication for blood pressure, arthritis, and sleep. Over 2 months, he developed fatigue, occasional dizziness, ankle swelling, and one episode of almost fainting when he stood up too fast after lunch. He blamed old age. His wife blamed the heat. His son blamed lack of exercise. Nobody blamed the medication pattern until the day David nearly fell in the garage. One evaluation later, it became clear that his blood pressure treatment needed review, his hydration was poor, one of his other medicines was making things worse, and the aging problem everyone assumed was really a medication problem hiding in plain sight. Take care of yourself, pay attention to what your body is telling you, and I'll see you in the next video.